Everybody knows, especially in this area, the opioid epidemic is completely out of control. What this article points out is journalists and lawmakers, the United States Congress, they have pushed the blame for the opioid epidemic on Big Pharma and Purdue for the manufacturing and lying about OxyContin, right? Manufactured a shit ton of it, said it wasn't as dangerous as it was. It went out to millions of people who really probably didn't need it. Some that did, but millions that probably didn't. And this whole thing got out of hand. It's all their fault. Well, this article points out that policy also played a role in this, because in 2011 there was a policy that said that we should limit the amount of opioid medicine going in to hospitals and doctors' offices as prescriptions. So from a policy standpoint, we enacted a prohibition of sorts, saying that limiting the amount that doctors could prescribe. Now, the reason why that's a problem is because when people are addicted to something, and then something that is legal and you can get very easily. The reason why they did it in 2011 was to crack down on the pill mills. I don't know if you've heard that term before, but essentially almost everywhere. I know it desecrated the Midwest, but there were these phony doctors' offices and these shady pharmacies that would literally just write you a prescription for showing up. You could just pay and you would get a prescription for OxyContin, which was addicting thousands and thousands of young people every day. In 2020, according to this article, there were 100,000 overdose deaths, which is more than any year in American history. Now, we can probably pay some attribute to that to the pandemic, right? We were locked inside, people got depressed, all that sort of stuff. But still, that's a lot of fucking people that died from overdose. So in 2011, to go back, they being Congress, enacted legislation to limit the amount of opiates going into doctors' offices, effectively shutting down a bunch of these pill mills. Now, why is that not necessarily the best way to go? Because what you're doing is you are taking a group of people with a serious medical condition, addiction, and you are forcing them to quit cold turkey, which for people who are using OxyContin and opiates responsibly, because they actually need it, you are lowering their dose, and that happened. There's proof of that in this article. That happened. They cut it back, some of the dosage and some of the amount that you're allowed to have in a certain prescription. So there are people who are taking them legitimately who have their supplies cut in half. Well, we know that these drugs are highly addictive, and we know they work really well. So if you are using it because they work really well and you're using it responsibly, now it's cut away from you, so you have to turn to street dealers to get, pills if you can, or a lot of them turn to heroin, which we know is terrible. Same thing with if you aren't using them responsibly, but you're addicted, and then they just cut that off. Well, you're forcing those people into withdrawal. And opioid withdrawal, I guess, never experienced it, but it's fucking terrible. It's some of the worst symptoms you can have. Flu, itchy, you fucking twitch. I mean, it's a horrible time, apparently. And you're forcing those people to go through that, which is inhumane. And then because the demand is increased and the supply is decreased, they turn to street drugs, heroin, and then ultimately the heroin suppliers are cutting it with fentanyl, which is a synthetic opioid, and it is thousands of times stronger than what these people are used to. Overdose, right? So it is, in my view, and in this article's view, the supply side prohibition is not the way to go about it. And I have said publicly that prohibition of any kind I don't agree with, whether it be opiates, whether it be alcohol, whether it be marijuana, whether it be whatever. Whatever you want to cut the supply of, you should probably do something on the demand end rather than the supply end. And I don't mean arrest everybody and put them in prison, because that, we know, because of the war on drugs, doesn't work either. Actually, it's probably worse. So what do we do? There are treatments mentioned in this article, certain drugs that so there are two medications called Suboxone and Methadone that are proven to cut overdose death by 50% or more. So what this article argues is that when the government shut down these pill mills, they should have taken the data. Now, I know that probably violates the HIPAA, the government is not allowed to see your medical records, but the pharmacies have the names of the people who are coming back regularly and getting these pills. In order to get a prescription in this country for narcotics, anything Schedule 1, you need a government ID. So the government already knows, or not the government, the pharmacies and the pill mills have your info, right? They have your name and phone number and address. So what the government could have done is reach out to those people when the pill mill eventually shut down and give them treatment, right? Give them these safer alternatives to these drugs to help wean them off and help their addiction with, counseling services and all that sort of thing. But instead, what they did was nothing. They just said, okay, all these people are addicted and dying, so what do? Let's take the substance away from them. That'll work. Well, it doesn't, because what it does is it allows for more gang and drug violence, cartels to move into areas that they weren't involved in the first place. Overdoses begin to skyrocket. It's a bad thing. They make the in this article they make the comparison to the Prohibition days with alcohol, because. Or they compare fentanyl with whiskey in the Prohibition days. Fentanyl is a lot cheaper to make, so you can make a lot of it, and it is far more potent, so you don't need that much of it, so it's easier to smuggle and conceal. They made the comparison to whiskey in Prohibition. It is way more potent than beer, so you don't need that much of it, so it's easier to smuggle. That's why they refer to people as bootleggers, because they would hide whiskey flasks in their boots. Kind of cool. I didn't actually know that. There were more, or the overdose numbers rose dramatically from the period of 2011 when they did this change to 2020, which just goes to show that prohibition of any kind is probably not the way to do it on the supply side. Now, you can attack the demand side, like I mentioned before, with treatment centers, reaching out to those in need and giving them alternatives, safe sites where you can use under the supervision of someone responsible. They also talk about how when you take somebody who needs it legitimately, they know how much they're getting and the dose that they're getting, so they can sort of be trusted with the substance. Well, when you put that person on the street now and you're getting the same drugs illegally, the dosage, the potency, what's in it, the purity level, the drug dealer and the suppliers either probably don't know, and they're not going to tell you. So you have a lot more people ODing and dying of overdose who were not addicted per se in the first place. They had a legitimate prescription for this drug because they had back surgery or whatever, or they have chronic nerve damage and they need these opiates in order to not be in fucking horrible pain. Well, when you take that away from someone, first of all, that's inhumane, and second of all, they're still going to need that drug. So they're going to go to other places to get it. And those other places where they get it probably aren't the best places to get it from because of all the things I just mentioned. So, gotta love that.